About 1 in 2 women and 1 in 4 men are affected by osteoporosis, a disease that weakens a person's bone structure and increases the risks of fractures. Often there are no symptoms or pain until an accident occurs. We sat down with family doctor Norma Solis to learn more. So thank you so much for being here today and talking about osteoporosis. Give me a little background on what that is.
So osteoporosis is essentially a thinning of the bone. The bone becomes porous, and with it becoming porous, it becomes weaker, fragile, and it increased the risk of fracture.
All right, and so who is most at risk and how do they prevent it?
So with osteoporosis, there are a variety of things that can cause thinning of the bone, but the most prevalent is the aging process and hormonal levels, which fluctuate as we age and basically decrease. And the hormone levels are basically what help with stability of the bone. So as we age, we have a higher risk of fracture. And so some of the other risk factors that accompany aging are sedentary status, loss of balance, and dietary issues that will also increase the risk. So everybody, once you reach a certain age, should be screened for osteoporosis because it's a silent disease. You don't have pain when you have osteoporosis. You don't feel that your bones are getting thin. Some people may notice that they are losing some height. Some people may notice that they're stooping a little, and that may be a sign that their bone is thinning. But people essentially won't know that they have osteoporosis until they have a fracture. So once they have a fracture, now it's created just a slew of problems for them.
So what is the treatment?
There are a variety of treatments. Obviously, we try to focus on prevention. So we try to encourage people to have a healthy diet, avoid risk factors such as smoking, high-fat diet, sedentary lifestyle, weight gain, and things that will change their balance. Because as their balance changes, so does their increased risk of falling. So we focus on prevention primarily. And then we talk to them about making sure they have a nutrient-rich diet that's high in calcium and vitamin D to help with stability. If they get to the point where they have osteoporosis, then we have to make a decision about what their risk factors are and how at risk they are to have a fracture within the next 10 years. Using that information, then we decide on the treatment type. There are oral treatments, there are injectable treatments, and there are IV treatments. Some are geared towards slowing down the breakdown process, and others are geared towards helping with bone formation. So it just depends on how severe the disease is and the patient's response to the medication.
Sure. So what would be the first step that someone, as you said that there are no symptoms usually in the beginning, so what would be the first step in someone trying to find that out?
So we try to screen everybody, when they come along for their regular exam. There's also a guideline that the Medicare guidelines have for osteoporosis screening so that we can catch those people that maybe don't come in to the office for sick visits, but come in for what is called a wellness visit.
Well, thank you so much for being here.
Sure, my pleasure. Thank you.
Thank you.